Hello, my name is Maureen Haan, and I am the President and CEO of the Canadian Council on Rehabilitation and Work, and I'm also a steering committee member for the Disability and Work Canada. It's my pleasure to introduce you to our panel today, The Community Journey to Work, Unpacking Indigenous, Newcomer, and Mental Illness Experiences. On our panel today, we will have 4 speakers. Mario Calla is the Executive Director of COSTI Immigrant Services and will be speaking to us about the Newcomer to Canada experience. Next, Rachelle Nimegeers, who is the Employment Engagement Coordinator, British Columbia Aboriginal Network on Disability Society, will be sharing the experiences of the Indigenous population. Following Rachelle, Joseph Giulione is the Executive Director from Nimegeers, and he will unpack mental illness at work. Finally, Sultana Jahangir, the Executive Director from the South Asian Women's Rights Organization, will share information on South Asian women in the workforce. Following our panel, we will have a live moderated Q&A. I hope you enjoy your time with this insightful panel today.
Good day, everyone. Thank you for the opportunity to speak to you about the intersection of being a newcomer or immigrant in Canada and having a disability. I will address some of the factors or dynamics that a service provider needs to take into consideration when working with this particular demographic. The organization where I work, COSTI Immigrant Services, is a settlement agency in Toronto region providing a broad range of services, including English language classes, employment services, settlement counseling, mental health counseling, and shelter for refugees, to name a few. We serve about 39,000 newcomers a year, and our staff speak over 60 different languages. We keep very busy as Toronto region is the most popular destination for immigrants. Last year, Toronto attracted nearly 118,000 immigrants, or a third of Canada's newcomer total. These numbers are about to go up once we get beyond this pandemic, as the federal government has just announced its national target for next year will increase to 401,000, up from 340,000 last year. The impact of this is that 46% of Toronto region's population is foreign-born. What does this mean in the context of disability? You may have heard of the so-called healthy immigrant effect. Studies have shown that new immigrant arrivals are typically more likely to report better health and are less likely to report chronic conditions or disabilities than the Canadian-born population. This is attributed to the fact that those in good health are more likely to immigrate to Canada, along with the fact that the screening process at the time of entry disqualifies those with serious medical conditions. The thing to remember is that unfortunately, with time, their health status declines toward levels observed within the broader population. The other thing to understand is that for refugees, who represent roughly 12 to 15% of arrivals, the medical prerequisites do not apply in the selection process. This means that we receive many refugees who have serious medical conditions, both physical and mental. So what are the implications of working with such a diverse community? There are 2 factors to consider in working with immigrants with disabilities. Firstly, the challenge presented by the process of settling in a new and unfamiliar country. And secondly, the significance of culture in determining how families deal with health issues or disabilities. Let's look at the reality of settling in a new country first. Immigrants with disabilities face significantly greater challenges in integrating into Canadian society as compared to non-immigrants with disabilities, as their life is complicated by language barriers, trying to navigate an unfamiliar system, and lower incomes. Then there are a broad range of employment issues, including a lack of Canadian work experience, which is a significant barrier, and the lack of recognition of professional credentials and education. There's also evidence of discrimination based on race and religion. These are significant challenges for all immigrants, whether or not they have a disability. Disability creates another level of complexity. Let me illustrate how it plays out for newcomers who we have served who have become disabled due to a workplace accident. In addition to the sudden change in lifestyle and loss of income, challenges include language barriers. The individual requires help with translation and interpretation completion of documents. Then there's lack of understanding of various systems, WSIB, health, legal systems, Ministry of Labor, the role of their trade union. Then there's the reality of having few family and friends in Canada, leading to loneliness, despair, and depression. As you can see, newcomers with disabilities are put in a greater state of dependence, created by their lack of language and understanding of our systems. The second factor I want to talk about is the significance of culture on managing health and disability. The most significant challenge is the stigma associated with mental illness, something that our culture shares to some extent. Let me illustrate how this can play out. Our agency has a mental health center that provides services in several languages. One day we got a call from an older Italian woman who indicated that her son, a young man, had not come out of his room in several months. She and her husband had not seen him, as they would leave food for him outside his door and he would receive it when they were back downstairs. He would use the bathroom mostly at night. Our counselor agreed to go out and see what he could do. After some time talking through the closed door, he managed to get a response, eventually convincing the young man to open the door. What he saw was a disheveled man that looked like the character Rip Van Winkle. Long beard, matted hair, long nails. Working with our psychiatrists, we got this young man into a mental health facility where he was put on the road to recovery. For his parents, the stigma and shame of having a son who was failing their expectations and what they perceived to be the expectations of their community held them back from taking action. Some still see mental illness as a character flaw, and it holds them back. It helped that in this case, they could reach out to someone who spoke their language and understood their situation. We find that for some, the term disability has a very negative social outlook for the individual. Therefore, they do not disclose it. They fear that disclosing their disability will impact their employment opportunities. Sometimes job opportunities are affected not by the health of the individual, but by the health of a loved one. For example, in one case, the mother, a convention refugee, had a child with autism. She applied to a special education program, but due to the long wait list, the mother had to remain home for months to care for the child, which created financial hardship for the family. The most common situations, though, involve health issues that frustrate the settlement process, which in turn make it difficult for a newcomer to be job ready. For example, the 32-year-old Syrian refugee man who arrived in Canada full of hope for a better future where he would go to school and find a decent job. Since arriving here, he has been diagnosed with thalassemia, requiring a blood transfusion once a month. In addition, the trauma he suffered in the Syrian war and subsequent 2 years he spent in a refugee camp have made it difficult for him to focus on learning English. That in turn has made it difficult for him to work at developing his skills in preparation for a decent job. So it turns into a cycle. To conclude, what are the considerations in working with this demographic of newcomers? It starts with communicating in the person's first language. These are complex issues that are difficult to address if there isn't clear communication. Ideally, you want staff who speak the second language. Cultural competence is also essential. We need to understand the cultural norms that are driving the behavior. Those norms can be powerful, and change will not happen unless they are understood and one works within them. Make sure the settlement issues are addressed, such as learning English and job readiness. We work with employers to provide co-ops in order to allow individuals to gain Canadian work experience. Lastly, use effective strategies that you already utilize with people with disabilities to employ newcomers with disabilities, such as engaging employers to consider job carving or modified work to employ them. Thank you for your time, and I look forward to our discussion. Rachelle, over to you.
All right, thank you again for the introduction. Again, I just want to acknowledge and thank the Coast Salish people for allowing us to live, work, and contribute to the lands here. My name is Rachelle, and I'm the Employment Engagement Coordinator here at the British Columbia Aboriginal Network on Disability Society. And I'm really excited, to have this opportunity to have a conversation as to how can we work together to apply an intersectional framework moving forward and creating an inclusive and accessible labor market. I think it's, really important to note that by using an intersectional approach, not only do we consider the multiple ways in which individuals are discriminated or oppressed, but also acknowledging them and finding solutions. Persons with disabilities who are part of racialized groups are more likely to be unemployed or underemployed. And with this in mind, Indigenous persons with disabilities, often face barriers that really limit their ability for achieving socially integrated and financially independent lives. Here at BCANDS, we provide various different services. We're an internationally recognized and award-winning nonprofit Indigenous disability organization. Some of these services include the Indigenous Disability Case Management, the PWD and Benefit Adjudication Program, Registered Disability Savings Program, and we have various different initiatives as well. The COVID-19, federal accessibility, and the Indigenous Support for Student Learning Program. For the Employment Engagement Initiative, we're coordinating efforts through different partnerships. We're trying to create opportunities for Indigenous peoples with disabilities, whether that's accessibility for employment or other services like training and equipment. We're really trying to use, this community-based strategy, getting these types of recommendations and trying to establish different solutions by exploring ways to eliminate gaps found in pay, employer stigma, accommodation, and different supports for even employment services. With this initiative, we're basing it on interviews that we're conducting with the community, labor experts, employers, individuals with disabilities, through this in-depth conversation. We're trying to use this project to hopefully and potentially impact cultural change and provide evidence-informed data that can help improve employment opportunities. Indigenous persons with disabilities have to be given the opportunity for self-determination and really be involved in the decision-making process to, improve inclusion in economic, political, and social policy development. It's important to recognize that, Indigenous persons with disabilities experience a disability rate that is twice that of the general population at around 30%. And really, there's this overall concern that, traditional equity-based employment has been failing Indigenous persons with disabilities by only focusing on, a few set identities rather than the complex and layered understanding that's really found in intersectionality. And that being said, there's a significant potential to really facilitate positive changes for Indigenous persons and their families living with disabilities by understanding and really acknowledging their lived experience. Culture and context really can't go unrecognized here. We have to consider factors such as colonialism, social exclusion, the geographic location, and how that affects access to services moving forward to develop an effective strategy that really promotes and enhances accessibility and inclusivity of Indigenous persons with disabilities. Indigenous persons with disabilities, their identity is really critical for improving and understanding among non-Indigenous groups. Information about existing services really has to be accessible, and a design for employment programs should be applied across urban, rural, and remote communities, considering as well jurisdiction. And finally, legislation should really provide a more holistic approach to accessibility so that a person's mind, body, and spirit are also supported at a more with a more intersectional framework. Also, engagement between Indigenous persons with disability and the larger community has to include information about traditional ways of knowing and an emphasis on the past, such as, residential schools, present, intergenerational trauma, and even the future realities. What kind of solutions can we identify here that can be found within the community? So based on these conversations I've had with social development workers and individuals, an intersectional framework for improving employment inclusivity for Indigenous persons with disability really has to take in consideration, Indigenous worldviews, employer perspectives, expertise from individuals living and working with disabilities, and really merge Western models and strategies that is compatible with Indigenous knowledge. I think it's important. I think supporting Indigenous people with disabilities and finding success really requires looking beyond employment and its benefits. How can we expect individuals to be active members of the labor market when basic needs aren't being met? Through my conversations with individuals and social development workers, it's evident that there's a need for mental and emotional support, adequate housing, transportation, access to the internet, and COVID-19 has also exacerbated these barriers, making access to employment almost virtually impossible. With communities being closed, it's difficult to go out and find these work opportunities, and band offices shut down. They're limited to accessing computers. Even without the impact of COVID-19, Indigenous persons with disabilities are often forced to, move to urban centers to seek employment, which introduces an entirely different kind of isolation. I think it's important, an important key for improving employment opportunities is really to develop a thorough understanding of the types of barriers and intersectional impacts that affect Indigenous persons with disabilities.
Thanks, Rachel, for sending it off to me. And I'd like to thank the panel for having me. I'm going to speak a little bit. I'm going to address mental illness and work, and I'm going to tie it into this whole pandemic thing that we're living and see if there's any positive things coming out of it. To start, I think when we're talking about mental illness and work, we have to start with the taboos that go around mental illness. They've been long spread. The societal view of mental illness has been quite negative for a long time, but it's starting to change, and it's been changing because people are asking us to talk about it. So you have Bell coming out with programs, you have athletes and celebrities and public figures talking about their situations and speaking out about their personal difficulties. And it's really important for these people to come out because it shows that mental illness is not limited to a specific category of people. It is sadly non-prejudicial. It'll go to wherever and it'll go to whoever. The encouraging part about the taboos being reduced is that there's more openness, and with more openness, there's more possibilities of becoming active members of our society. Difficulties remain. Mario was talking about a very good example of cultural apprehensions. The myths remain. We've had an incident in Quebec recently where the first thing that came out was, well, people with mental illness are all dangerous and violent, which is not true, but it is the headline because of a disastrous incident that should never happen. But they made ties to mental illness where sadly, I think that was just too simple of a situation. But when you look at it, it's still interesting where even if the taboos are coming down, the stigma is going up. We still have situations where employees will refuse to disclose that they have an illness. And they fear prejudice. They fear the negative backlash. They fear that they won't have access to promotions or won't have access to special projects. And their fear of not getting hired. And I could really make this, look, I run an employment service for people with mental illness. I've been doing this for 35 years. I have employees who have mental illness. We actually favor that. But during the interviews, people they'll never disclose. I always find out 3, 4, sometimes 6 months later. And when I ask them, well, why didn't you talk about it? They actually tell me, well, listen, Joe, we didn't want to talk about it. I didn't want to talk about it because I was sure that I wouldn't get the job. And if you're scared to talk about your mental illness when you want to work in an employment service for people with mental illness, well, what are you going to tell a regular employer? Not that I'm not regular, but you know what I'm saying? It's like, it's just normal. And this self-stigmatization is a major handicap, because what it is it's keeping people from actually asking for certain accommodations in their workplace that would make their work easier. And if their work is easier, well, then they're naturally going to be able to perform better. And if they're performing better, it's going to enhance their chances of not only advancement, but keeping their jobs. So it's like, it's a vicious circle that has to be broken. So how do you break the cycle, right? Well, you break the cycle by introducing the worker, giving him the tools, if he wants to disclose, how to disclose, and how to ask for accommodations if he needs them, and giving him the support to make sure that he gets through the rough patches, because everybody lives through rough patches, so that way he can perform to his capacities. And we're in a context now where, despite the stigma, we are in a situation where employers, there's a manpower shortage. So all of a sudden you have people who are a solution to the problem, and they have less fear, and they're prouder of themselves. And I would say the biggest change that I noticed in the last years, when we first used to promote our services, and we'd ask people that have gone through our services to get jobs to help in the promotion. They'd always be willing, as long as we took pictures from the back, show just my hands, but don't show my face. And the big difference is two years ago, the government needed people with disabilities to be part of a promotional package. And I asked some of our candidates if they would be interested. And it was interesting, because then I came into the spiel of, well, don't worry about it, we'll take you from the back and the whole thing. And I said, no, I want my picture on I want to be seen. I want my story to be told. And I want, look, I went through bad times and I'm working now. And if it can help somebody else, I want people to see who I am. And the big difference is now they're presenting themselves as workers with a disability, and not people with a disability that want to work. Identifying as a worker is the solution to the problem, because employers are looking for workers. And so we're actually bringing the solution to the problem. I'm going to tie in to the COVID, to the pandemic, because I think it's important. People with mental illness often live with, they have a tendency to isolate. So now we have a situation where people are in contexts where they have to isolate. And isolation is part of the problem. So how do you break that cycle? What do they need? And what are we living through? Like we're going through a structure right now where people who are struggling with fear and uncertainty are in a context where we're living with fear and uncertainty. We don't see the end at the end. We see the crisis, but we don't see a light at the end of the tunnel. People are in crisis. They don't know who to turn to, and they have new questions. We have clients calling us during this pandemic where, listen, I want to go to work. My boss wants me at work, but the people at the group home don't want me to leave because they're scared that I'm going to go out, get the virus, and bring the virus back into the home. So what do we do with that? And now all of a sudden we have to deal with a new concept, which is the rules are keeping us from working instead of the desire to work. And so that's a problem in itself. And for those that are staying home, because sadly during the first part of the pandemic, March to June, half of the people that we had gotten jobs for lost their jobs. And a lot of them live paycheck to paycheck. A lot of them are really, really insecure about their finances. They like to go onto the CERB. They can't because they don't know how. And so what we became a social service. We did their serve, we did their follow-ups, we do the good morning call to see how you're doing. I have 30 seconds, so I'm going to do this really quickly. All that to do is to say is that the aim was to break the cycle, to make people comfortable so that it would make them easier to transition back into the workplace. So if I was to conclude, and if I was to identify what we need, we have to make sure that everybody has access to services. We have people in certain regions that don't have access to mental health professionals, and that in 2020 it makes no sense. We have to make sure that everybody who needs accommodations in the workplace get the accommodations they need, and that support is offered, long-term support is offered to both the employees and the employers to make sure that this works. These workers are a solution to the manpower problem that Canada is going through right now. All we have to do is change the rules a little bit to make it easier for them, and it's going to be long-term success. So I'll close with that, and I'm going to pass the word on to Sultana.
Hello, everyone. I'm very, very pleased and thanks to be the part of this panel. And I saw and I heard it, all of you are covering all of the point that is really, really totally reflect the situation of my community's people. The mental health is a taboo. There is a stigma. People don't want to mention these things. And also the impact of this mental health in their family, in their life, and also the society. All of these things you all tell very nicely. I just want to mention that some of the unique and complex situation that faced by the immigrant and the racialized people, especially women of color and women of South Asian community, because we bring some external barrier before we come in Canada that raise because of our status in our own country. And when we come in here and we see that we bring this patriarchal society model in here, and that also another kind of suppression for our communities people to feel the mental strength and also the insecurity in here that really reflect on their life. I just give you some journey of the immigrant, those who are coming in here. Most of the people living in my community are the skilled immigrant. They come by their skill category, and their skill and all the experience already scanned before they come. They have a huge expectation. They are going to come in here, get a better job. And most of them are the cream of pie from their own country because they do the better job over there. They're coming to get more better life, especially the women come in here from third world to first world because they feel like they are going to get more opportunity, more equality in here. But as soon as they come, they cross the airport, they find it out the hardship to get a job in their related field. And the underemployment exists and underemployment occurs. When the underemployment is coming, that these women has to work in the lowest precarious sector. Their self-esteem is going so down, and mental stress of this lowest precarious work place that insecure income, insecure hour, and everything's impacted their life a lot. And especially all the work they're doing, it is create some kind of occupational disease that totally denied by the WSIB and totally denied by the systems that this is not the condition of the workplace outcome, it is a pre-existing condition. No, that women who are standing for 8 to 10 hours and working like a machine versus person, then they lose their capability. So like they create some kind of disease, and a lot of things are not available for them, like when they have impact of this workplace outcome that to go to the WSIB. I have some clients, those who get totally incapable to work and now settle down in ODSB and OW because they cannot work, they cannot stand up 8 to 10 hours. The doctor recommend not to do this kind of job anymore, so they don't have any other solution. So these are the things impacted the people. And when you have this precarious workplace situation and everything's in impact women's personal life, they become so isolated. They don't want to go outside. They don't want to talk. I have some clients, those who totally excluded themselves not to get any kind of social interaction to the other people. What sorrow do in this place? Sorrow support the women first to get a job that they immediately qualify for. Then when we send them to workplace, we find it out workplace does not comply with all kind of human rights condition in the precarious sector. So we raise this concern, we advocate for this thing. And successfully some place we make some changes. And then when the women always feel kind of isolated, we try to encourage them to do the social inclusiveness, build their leadership, and show them the light of the way that might be when they start their first journey, as they in the precarious work, they can move gradually to the other place. They can go for training, they can go for improving their skills. And sometimes we refer to them the professional organization to get more professional counseling, employment counseling. So some of them are getting better job right now. It takes 2 to 3 years to one person to do this hardship, so then they can get successfully settled in Canada. But these 3 to 4 years or 2 to 3 years, they need an intensive settlement support services and specialized employment services that will help them to get in touch with the labor market and also not losing their mental and physical stamina and not losing the hope. So like these are the work we do. We have a very sisterhood ambience that support the people to get cultural and employment inclusiveness, economic inclusiveness, and also support them sometimes to navigate their personal problem, like navigate their spousal peer pressure, navigate their childcare needs and everything. So like this sisterhood ambience is like the kind of extended family support for them. We are doing this thing. Before the pandemic, we find it out the society has inequality. We raise this concern a lot of time, that gender inequality, intersectional barrier, raise some kind of distance between this group of racialized women with the other group. So we need a specialized support for them. Equity is very important in here. But right now, when the COVID-19 is coming, it's revealed, it shows that inequality. We did a survey with 1,200 people. We make phone call to them and I try to find it out what is the situation. And we find it out that 89% people lost their job in that times. And those who are working, 30%, those are not doing the job in better sector. And also they are not getting the full hour, the hour get lost. Then we find it out that when the SARB is coming, almost 30% people are not eligible for the SARB because most of them lost the job in the December, because that times like January, February is a slow time. And they other also like some of them left the job because of the childcare need. So this is their personal need. So like we try to help and try to find it out how it could be inclusive and universal. We do the advocacy work, we contacted with everyone, we raise this concern that universality is important in here, inclusiveness is important here. If one person fall down from the crack, that person is going to bring the COVID to the community. Community contamination is a big serious thing that will happen. So we raise this concern. In the same times, we find it out our communities people has a very few computer literacy knowledge. They don't know how to apply for this thing. And definitely like Joseph or other, we are doing all the settlement services to them. So 251 application, we did it supporting them for CERB and continue ongoing supporting for this thing. And we find it out this is the time to talk about this inequality and the consequence of the mental and physical incapability in future for the people to work right now, to fix the workplace and fix the create the decent workplace for them. So then it could help them to get a better life in here. End of the time, we find it out that if we do not have a better life in here, we cannot give a better life to the people. We all deserve the Canadian standard life, that is 8 hours in a work, very decent time of break and decent amount of money. So then we don't need to work like more than 40 hours in a week. So I feel it like this is a wonderful presentation. Everyone already highlight all the issue and all the recommendation that what we should do it together, and together we'll make it the change. Thank you for everyone to give me this opportunity to talk.